some considerations when living with low back pain. And the type of low back pain that I want to talk about is specifically related to the lumbar spine and what happens when the disc is injured at a lumbar segment. A lot of people hear about L4-5 or L5-S1. Those are some commonly injured segments. If you're watching this, what I'd like you to do is, as you listen, try to fit yourself into the one of the following three categories. What we see is that the original or initial disc injury usually happens about the age of 20. And then as life proceeds, that disc injury at a specific level goes through various phases. And it begins to have a life of its own, basically potentially spanning a time period of up to or beyond about 70 years. Between 20 and 30 to 35 is what we call the injury phase. In the injury phase, that's where the disc first gets injured. It can bulge or become painful. And when that happens, people usually experience low back pain, occasionally pain in the buttock or down the leg. But a qualifying sign of belonging in this zone is that pain is worse in the morning and gets better as the day goes on. Folks feel better standing than sitting. When that's the case, you are usually a perfect patient for what's called McKenzie extension exercises. That works for this age group. But as we approach about the age of 30, 35 to 50, 55, that's what is called the instability phase. And in the instability phase, what we see is that that healthy disc that maybe was injured and got swollen and has a lot of pressure in it, now loses water content, gets thinner, and then the bones begin to slip and slide around. In this phase, very often people feel pain in the morning, better as the day goes on, and potentially worse again at the end of the day. Or you wake up one morning with pain on one side and the next morning with pain on the other side. So things become unpredictable. In this phase, sometimes simple things of picking up a pencil can cause a major flare-up. So this is called the instability phase. And then later, with time, we shift into what's called the adapted phase. And in the adapted phase, come what may, the body is going to do its best to stabilize. And here in the process of stabilization, that's when bone spurs occur, facet joints thicken, ligaments thicken, and people end up very often with two narrow pathways. The pathways are too narrow, not two, but many narrow pathways in the spinal region, and here the people often feel better in the morning and worse as the day goes on. Sometimes there's no back pain and only leg pain. So think about where you belong in the lifespan of a disc segment, and for each one of these regions or time phases, a different type of self-care is required.